The following is a presentation of the Healthcare Facilities Network.
Hello, and welcome to the Healthcare Facilities Network. I'm your host, Peter Martin, Vice President of Business Development for Cref. Cref has offices in Dallas, Boston, and Fort Lauderdale. Go to cref.com for more details. I am happy this morning to be joined on site at the Florida Healthcare Engineers Association Annual Conference. We are in Ocala, Florida. Three distinguished guests, and I'm going to ask them if they could introduce themselves, please. Adam, let's start with you.
Adam Mayle, FHEA State President, Senior Director of Facilities Management, Memorial Healthcare System, Hollywood, Florida.
Kirk Dickson, I am the President-elect, and I am with Advent Health, Facilities Director. I have 3 facilities that I oversee.
Kirk?
Skanda Skandaverl, I am the President of American Society of Healthcare Engineers, ASHE, and also I am the Division Director of Common Spirit Health in charge of Midwest.
Excellent. So I appreciate these gentlemen joining me on site. We were here actually in November. I interviewed Adam at the one-day conference. We came back for the multiple-day conference, and I have to say, Adam and Kirk, this is directed towards you gentlemen first. Big crowd. There's a whole building beyond us with exhibitors. There's kids running around. There were kids running around yesterday afternoon. It's been quite the conference. Tell a little bit about that, about the success of the attendance, the exhibitors, the kids. What's going on?
So there's a lot to unpack there. So we've been growing a lot the last few years. In fact, as I told you at the fall conference, when we last spoke, our attendance at that conference was 40% larger than the year before.
Wow.
And so now we've had, since then, we've experienced a 25% growth in our active members. That's the hospital directors. And overall, between active and supporting members, we've increased 11%. So with that growth comes larger venues, to accommodate the people that want to attend.
So 25% growth in active members since November is huge.
Yeah.
Is there something you guys did, or is it organic? What's happening?
Well, I have to give credit to one organization. It was HCA, who was not really in the fold before. They came to the fall conference. They saw what we can offer, the value and the quality of the training, and they went back and said, "Hey, this is valuable stuff. You should be a member." And they became members.
Wow, that's a great testimony. Skanda will go to the national level.
Yes.
And so, what about the marketing for this conference, bringing in, and that's a big vendor floor you guys have. I don't know what you think, Skanda, but I have not seen so many vendors at a chapter conference. I don't know if I ever have. I don't know about you. You've been to more than I have.
I think what I understood is we have more than 230 vendors here.
230.
And, I think Adam should know, but I think last evening what I heard is we had 986 people, and I'm crossing my fingers, so I can tell that I went to a conference, there 1,000 people showed up. So you need to make it up by end of the day. If you have to bring somebody from the street, it's okay. Because,
There's lots of horses out there.
I know. It's one of my mission when I become the ASHE President is to visit every chapter. In ASHE, we have 54 chapters. And the ASHE staff asked me, "Hey, Mr. President, we have only 52 weeks in the year. How are you going to make it 54 chapters?" Well, then I had to pick and choose, and I chose Florida. And of course, I chose Hawaii, and I chose Texas. And I was in Texas, and Texas, I was excited because they had about 780 people in Texas. And when I heard about the 986, I was so excited. And one of the things that I'm doing, Peter and Adam and Eric, is I normally fly in and give a speech and fly out. I change it. I stay overnight and spend the full conference with the people because I like to talk to people one-on-one, understand not only their professional life, about their personal life, how we can help as a healthcare together, because healthcare needs a collaboration right now. Our landscape is, our delivery landscape is changing. We need to collaborate. We cannot survive. And ASHE is 12,500 members, and I'm so excited to see members like in Texas. We have about 1,200, 1,400 members. But the interaction has been a little stale. So my mission is to bring them back. So going forward, we can do a better job. Together, we do better.
How does what's the interaction like, and perhaps interaction is the wrong word, but from the national ASHE and the chapters down at the local level, how does that relationship work, and is it, do you see ways to improve that or keep it going? What are your thoughts? And from both perspectives, because obviously Skanda, the national, but you've worked local chapters before you went to ASHE, and then Adam and Kirk, your perspective.
Yeah, we are a family. We are, what did they say, 54 chapters, and we have 10 regions. We have 10 board members, and we do have 2 vendor members on the board, and we do meet in the PDC conference and ASHE conference, and we do have all other telephone calls between the presidents of the chapter and also the board members talk to the individual chapter. And they do have local conferences, and healthcare workers, they're always very busy.
Yeah.
Directors. For them to get away from the hospital is very difficult. So what is my mission from an ASHE is we are trying to take ASHE to the local level. And me spending 3 days in Florida, I'm meeting with the president directors and talking to them directly what is the real issue they have. And I digest that and take it to the national level. For an example, it's not yet official, but yesterday we have a victory in the FHEA. I think ASHE get through the, not trying to test the 5 dampers, and again, it has to go through a couple of councils before it becomes official. And we don't need to do a 5 damper every 8 years. That's a huge victory for us, because that is a kind of a, when you go and try to clean the 5 dampers, it stir up all kind of dust and things. We have to think about the patients we have. And it's not only expensive, it's a huge inconvenience, and also put our patients at risk. So there's a big relief. So as you take upon these big advocacy issues, because they have the staff, and they collect information from all these chapters, so they have a voice to go to the NFPA. The local chapters can do the same thing, and so we are here to help the hospital directors. That's our mission.
Yeah.
And the chapters are part of us. I mean, that's what I say. I go around and talk to people. They think, what is ASHE? ASHE have only about 30 staff. I mean, the rest of us, we are volunteers. So we are ASHE. Local chapter is ASHE. Every member is the local chapter. Just imagine, Adam cannot run this place if nobody showed up.
Right.
I mean, 1,000 people, they are the synergy for this organization.
Yeah, yeah. So along those lines, Kirk, to you.
So I think the support that we get from the ASHE from the national level, it does get pushed down. The advocacy that we get from them is a huge help. They hear us, and when we come together, it gives us a much larger voice when they get to these NFPA conferences. And as well as the education that they make available to us and also to our teams is invaluable. The certifications that they offer are widely recognized within our industry, and the C-suite folks are starting to take more notice.
Interesting. So you brought it up. So Kirk brought up the C-suite folks. How do you, I was thinking more along the lines of training and education, which your folks, and I'm sure you guys would say, I'm too busy to go, but yet you got to make it that priority. As the relationship with the C-suite, especially as the demands are increasing on you guys, how is that C-suite relationship changing, or is it?
Well, I think it definitely is. I think that the C-suites are being more demanding, as you said, but they're also starting to ask questions. Why does this conference take 3 days? And so we've started at the local level. They don't want us out of the office.
Yeah.
They think that we need to be in the, and they're right. We do need to be in the office.
Yeah.
But so one of the things we're doing at the local level is taking a look, and we're going to start our conferences on a weekend, and we'll only run into 2 weekdays for the conference, and then and get everybody back into the office 3 days a week. And I think that's going to make it more palatable for the C-suite teams. And there's some of them are starting to get out and see what we do in the educations that we give, and they're starting to jump on board. Just like Adam said, HCA, a huge growth opportunity for us, and it's largely because some of the C-suite folks got to see what we do. So reaching out to them, and that's a great help that we also get from ASHE, is they have access to the C-suite that sometimes we don't.
Yeah. What's your C-suite perspective, Skanda?
I think one of the things is when when I was in the campaign trail, what I was telling is I'm going to build bridges between the American College of Healthcare executives, because they do have their conferences now. We are going to their conferences, and we are trying to invite them to our conferences, because they need to understand we are a team.
Yeah.
And they have their conferences in Chicago, and next time they are going to have it in Boston. We are trying to capture and take their platform to tell them what we are doing to save money. And their mission, they run the hospital. They are the people who can give us money.
Yeah.
And our infrastructure needs some help. And there are some hospitals, the infrastructure is deteriorating. We are doing patchwork. And they need to understand, if you don't do that, what is going to be the end result.
Yeah.
Because they are focusing on profit, and you need profit. There's no money. You can't run a hospital. So they have their work to do. So we have to enhance the communication, and I was very surprised to see an HCS executive here, and he was, hey, where are my guys? I don't see my guys. He was taking notes, so I mean that's a good thing.
Watch out, guys.
Yeah, watch out, guys, because I think that's what we need. I like to see executives of the hospital coming up to our conferences, and we also need to change some of our presentation for them, so they could benefit. We need to start speaking their language, return of investment, so we are beginning to do that.
Takes a while, huh?
It's take a while, because they have their own things to do. We have our own things to do, and both of us are busy. Sometimes we forget to communicate.
Right.
That's what we need to do.
When I started in healthcare some 25 years ago, we didn't have a lot of requirements when Joint Commission showed up from a facilities perspective. And now we have the majority of the requirements. And a lot of those roll up to the leadership findings if you're not doing things correctly. They say, hey, that's leadership's fault. So it's kind of forced that relationship with administration. And I think the better organizations are giving facilities a seat at the table now because of that.
That's interesting. You just used that word. I never really thought about that before. Like forced. It's almost like, and we were talking a little bit about this earlier, Skanda, that the environment today between failing infrastructure, not enough employees, sustainability, decarbonization, it's forcing a relationship where maybe the C-suite didn't want that, and maybe I'm speaking badly because I'm coming from a facilities perspective. They may not want the relationship, but it's being forced upon them, right?
Yeah.
In way.
Well,
it's an interesting flip.
Yeah, I mean, if you look at it just from a financial perspective, which is what, listen, rightfully so, that's what most administrations are watching closely. We're spending more and more money.
Yeah.
Facilities department budgets have to grow now to accommodate all these new requirements. It's not inexpensive to be compliant with Joint Commission. It's a very expensive process. So I think I think if nothing else, that is forcing the relationship more so maybe than if you're out of a leadership.
Yeah, absolutely.
I would completely agree with Adam on that. It's being forced with more and more money. I think the one thing is, the C-suite folks, they're in competition with each other. They all want the business. one nice thing about the local chapter here, if I've got a problem, I can pick up the phone and I can call any facility director within the state and say, hey, I need help. Can you help me with this? And we're a tight-knit family. So we are all willing to help each other. We share trade secrets. I don't know if the C-suite folks want to hear that, but we do.
Right.
And that makes it really nice. And that's a big part of being a part of this organization.
I was talking to Mike Neely yesterday, who's part of your organization, and he said, we were talking to him, he said this group, and you've probably seen this, and I'll go to you next to ask your impressions from across the country, but he was saying, like, this group, he's like, we all talk to each other. He's like, I call any hospital, they help me, I help them. Because really, you guys are in it together. I mean, you're not a silo. You might be a silo in your own hospital, which is interesting. You might be siloed in your hospital, but yet you're not siloed among facility directors because you can't.
Yeah, well, we're in a state that's, 5-6 months out of the year, we have a season called hurricane season.
Yeah.
And so it kind of, I don't want to use forced, but if you're not doing it willingly, you're going to be forced to collaborate with others. Because we all have the same mission, to provide quality patient care. Nobody wants a hospital evacuation. So if I have a piece of equipment and somebody else, got hit with a hurricane, even not part of my organization, I would go to my administration. But I'm entirely confident that they would say yes, send them that motor. And it's happened to us. We've had to get from other facilities as well.
Yeah.
So it's really about the patient care, regardless of what organization.
It's really a great trait that a lot of people don't know unless they kind of work in it and pay attention to it. That you guys are like that. Skanda, how many chapters have you been to this year so far?
I think I have been traveling twice a month, so
I'm not mad at you. I'm just
months, I mean, so I mean, I think I was shooting for about 20 chapters end of the year.
Okay.
So I think I have been through like that. Not only I'm traveling to America, I have gone to Canada too. I went twice to Canada, and what I'm seeing is Canadian healthcare is similar to us. Of course, their delivery system is different. I am so surprised to see the same vendors I see there. And the Trimco is there, the roofing company is there, and some of them are saying, hey, our factory is in United States.
Yeah.
So with the technology is so close, I'm seeing all the vendors in Florida, the same vendors I saw in Florida, in Texas. I have the same vendors in Hawaii. So I think we are so close. I think Adam, you said about, picking the phone and calling another director. Our technology is so easy right now. Adam can call me tomorrow and say, hey, Skanda, I have this problem. I can get him help because I know all the people all over the United States. Because even yesterday I was talking to several vendors there. I asked, what is the density you thought? They said, all over the United States. So the technology is so good, so it's advantage for us to be together. And I work for a larger company, and one of the advantages we have a leverage of buying power.
Yeah.
Because we have so many hospitals, we can go to a vendor and okay, we'll partnership with you. What's the price? So if you are working with the same vendor in all over the place, chapters have the advantage. And ASHE has not taken the step of partnering with vendors, but it's something that we can think about it, because once we become partners, it's much easier. You have a problem, you don't waste time negotiating the price, because he or she's your partner.
Just
keep moving.
I think relationships, partnerships, collaboration, that's the key going forward. And I know, so we're coming up at the end. These gentlemen are busy. Told them I'd only keep them 20, 25 minutes, so I appreciate their time. In closing, firstly, just the kids that you had here yesterday, does that normally have, like, a lot of children?
It's a first.
So you encourage the people attending to bring their kids with them as well? There was one boy, I don't know if you saw him, he was in the middle of the exhibit hall, and he had a gun with the bubbles.
Okay,
Bubble gum.
It was awesome, bubble gum. My kids are rolling it up. But he was running, it was nice. I mean, it was a nice juxtaposition. You're not like, that kid. It was kind of cool to see it in that big space. So tell me about that.
So I did not bring my granddaughter to this one, but my granddaughter usually does come with me.
Nice.
And it's nice to see the kids be able to come and enjoy it. The venue that we had here is incredible, and there's been a lot to do, and I think that was, Adam, I'll let you speak more to it, but I believe that was a big driver as to why we said, hey, let's bring families. But my granddaughter absolutely loves this organization. And everybody,
She a member?
She's going to be the president one
She'll
day.
probably be running it one day. If you meet her,
And
you'll
Adam will
understand.
attest to it. She's pretty vibrant, and I think just about everybody in this organization knows my granddaughter. So I feel very safe when she's out running around with this group.
Awesome. Hey, listen, there's a lot of value in that.
Yeah, so what happened was we're usually either on a beach or near like Disney or a theme park. And that wasn't the case here. Because as we've grown, the amount of space we take up has grown.
Yeah.
And we are adamant about keeping the cost down for our membership. So the more space we take up, the larger the facility and usually the increase in the room cost. The World Equestrian Center, I mean, amazing facility. I wish the people on the camera could see what we're seeing right now. I mean, it's a football field plus.
Right.
Oh, yeah.
Yeah.
And so, you know, with that, we said, okay, well, we're not near a beach, we're not near a theme park. There's nothing else for the families to do. And this is a very family-friendly location. So we said, you know what, let's integrate the families and make them part of it. We had a family barbecue last night.
Bouncy houses.
Bounce
Richie,
houses, yeah.
Bouncy houses over there. It's fantastic. Last question, Skanda, I want to go to you for this. I know you have a conference coming up. So 2 questions. What's going on in Anaheim? When and what's going on? And what's next? Now that you're president, what are you thinking next? I know you have a job, but
ASHE is the journey, and I'm just moving ASHE from one harbor to another harbor. Another, my president-elect will take over, and so this is the healthcare is the journey. And one of the things is they were talking about bringing the grandkids and kids and the family. One of the things we have the challenge or opportunity, whatever you call it. We are hurting for technical staff. So we don't have people entering healthcare facilities. We need to attract. Yeah. So it's going to be our children and grandchildren have to be helping us, and we need to bring in young generation into the healthcare and train them, because there is no universities or college teaching kids to become a healthcare facility engineer. I think in my speech I was trying to tell them I'm an electrical engineer, become a healthcare, because anybody can learn healthcare. So I think bringing family, I mean, we are like we're talking about ASHE. You asked about Anaheim. That is one of the things that we need to introduce healthcare to the young generation. Talk about Anaheim. It's the first name change, new branded conference we call Facilities Innovation Conference. And I'm a little greedy. I want 4,000 people show up.
4,000.
I'm crossing my finger, and 4,000 people, it's among us achievement. To bring them together, and what we are teaching them and what we are showing is collaboration. We need collaboration and partnership for us to survive. And there are 2 things we need: food to survive. When we fall sick, we need healthcare. So we need to preserve this healthcare. And I thought these presidents and president-elect and for volunteering to partnership in our mission. So thank you for interviewing and putting this message out for the public to see. So anybody watching this want to join healthcare, please call Peter, and we will find you a job, and we will train you.
Absolutely. So Skanda, Kirk, Adam, thank you for your time this morning. Great conference. See you in July. See you gentlemen again. Peter Martin for the Healthcare Facilities Network. As always, thank you for tuning in. Have a great day.